Mindfulness is an intervention or a meditation practice that can actually be used when people encounter an uncomfortable craving or an urge to act out their addictive behaviors. The way it works is essentially often when someone encounters a craving or an urge, there's a belief about that craving or an urge, and the meaning that gets attached to it is, this is bad. But really, the craving or the urge to act out is neither good nor bad. And when we use mindfulness, that's exactly what we do. We suspend judgment about the craving. I mean, I understand why patients have that belief, because historically, the craving or the urge leads to the behavior. And the behavior has all of these negative consequences that have been bad for them. And so often they immediately assume that the craving itself is bad. But the craving is just a physiological experience that they encounter, that they often feel through their increased heart rate or respirations, or just even psychologically their beliefs about, I've got to do something with this craving. In mindfulness, what we do is we learn how to be present with that craving, to coexist with that craving. Rather than having this, I have to slay the dragon mentality, we try to help patients through mindfulness learn to coexist with the craving or the urge and not give it special status or attach this meaning to it that's judgmental, meaning it's bad. That would be a judgment. In mindfulness, we suspend that judgment. And so through mindfulness exercises, a person, for example, might feel this craving, they might feel this urge to act out their addictive behaviors, but they would learn to be present with that and pay attention to what happens physiologically in the body. And what patients will often report is this pattern or this timeline where the craving urges and it rises, and they feel this intensity, and then it kind of subsides. It might rise, it subsides, and then it kind of just gently goes away. Not because that's the goal of mindfulness, but because by being okay with the craving and the urge and being willing to be present with that craving and the urge, the natural timeline is that it doesn't last forever. It comes, it goes, it waxes, it wanes, but that they realize, wow, I can tolerate this craving and the urge, and I don't have to act out on it. And that all of a sudden creates a totally different relationship with cravings and urges that historically have led to acting out. Now, I can actually reorganize my relationship with this craving and urge, and I can coexist with it, and it doesn't have to lead to my addictive behaviors.